My name is Jeff Ostraker. This is Nina Agarwal. We work together. I'm a pediatric emergency medicine doctor at Cohen's, which is that way, I think. Maybe that way. Thank you. We're a large level 1 trauma center, and we take care of a lot of kids who get shot. And that sort of got me interested in pediatric gun violence, where I met Nina. Nina is a child abuse pediatrician at Lincoln Hospital in the Bronx. And together we run the American Academy of Pediatrics initiative on gun violence prevention.
We're really excited to talk with you. You know, we've been talking with a lot of physicians and medical students about gun violence prevention. And, you know, Parkland was a game changer. You know, people are just so interested in getting involved. And so we're really happy to talk with educators. This is new for us. We did talk with the Office of School Health in New York City, which was great. We're kind of short on time, so we want to make this as interactive as possible. So how many of you in the room have had like things that come up about guns in your work environment? Okay. Has this been like since Parkland? Yeah, over the years. Okay. How about like any other like gun, you know, any gun violence issues outside of work? Yeah.
From my perspective, many students in my high school feel that it's not really their problem. It's terrible. They have a lot of empathy, but they don't feel like this is never going to happen in our school.
Is it like a white suburban school? So they're not connecting with Parkland.
They are, you know, for a week or two. And now it's, you know, they identify and they empathize, but it's not something that's going to happen here.
Right. How about you and
that is your peer, that is your cohort, this is your world.
And that's reflective of what happens in the public. You know, the media goes up and then the media goes away and then Donald Trump comes back. There's always something going on, you know? So how about anybody have other school issues, like kids scared?
We have a bomb scare going on in our district right now, apparently what happened today. So
and the district next to you, just letting you have one last. We have one left in our high school that actually ended up dismissing the students in an entire day.
What about armed guards in schools? Is that an issue that your schools are all talking about right now, or no? It's sort of a big debate on Long Island right now. I'm just curious.
I've been going to our board event meetings for other reasons, and regularly there is at least 2 or 3 community members who keep asking, when are we hiring armed guards? When are we hiring retired police officers?
So how many people in here feel that there should be armed guards at your school? No. How about teachers, arming teachers? No. Okay, good. We're on the same page.
The hospital, though, I mean, we recently found out that they're now allowing some security personnel to carry guns.
And they're police officers. And,
trained police officers.
Yeah.
Right, I'm talking about security. I'm not teachers.
Right.
Trained professionals.
Yeah, we kind of talked about that actually, and we were on board with it. It's not like everybody is, but I mean, we felt like there's enough violence going on in at hospitals to have. We have gang members. I work in the South Bronx, and they're violent people all the time, and you just see them in the lobby. So I think that we're on board with that. So what we want to talk about today is like what is happening, but you know, I put this into what we know, what we don't know, and what we want to know, because it just seems like everybody is thinking there's no solution to this, and it becomes overwhelming. So what we've been doing is trying to figure out what are the solutions, and let's work on that. You know, everybody knows the problem. It's all over the news, but they really don't talk about the solutions. And so, you know, people say it's a public health issue, right? And I don't know if people know what that really means. It's a public health issue. So can anybody name like, you know, the CV infectious schools, the biggest public health issue right now for kids? Opioids, yeah. So opioids, they call it the opioid crisis, right? And what's happening with that is a lot of resources are going into that, into identifying the problem, who are the kids who are going to take it, giving antidotes, right, for free, and educating parents, making doctors not prescribe it anymore. There's been this whole public health approach to that. So they're not necessarily changing the behavior of the child, they're changing the environment to make it less accessible. And that's what gun violence we want to be. So gun violence is a public health crisis. It just has not been declared. Opioids is an official public health crisis, which means that all those things we just talked about go into solving the problem. And they've already found that doctors are prescribing less opioids, which means it's working. And the public health approach is to identify the problem, figure out solutions, test those solutions, and then implement them on a large scale. So if Ebola killed like 106 people in one day, I think the CDC would mobilize and they would figure out a solution to stop it from happening again. So opioids kill, can anybody guess? Well, opioids kill about 115 people a day. How many people do guns kill, do you think, a day? More or less? More. What are you thinking? Well, that's a lot, yeah. That would probably...
Just rude our point.
You're going to, I think the point is valid, that would be injuries and deaths. So it kills 106 people per day, which is right there with opioids. So why has opioids been declared a public health crisis? And everybody's all over protecting people from dying, and especially kids is something that we feel close to. The flu was declared a public health crisis by New York State. Do you know about how many kids the flu kills per year? About 100. And it's a public health emergency for New York State. And again, gun violence kills 2,370 kids per year, which is 7 to 8 kids per day, which blows away, the flu. So what's the difference? Why is one, they're clearly killing people, right? They're all preventable, but why is one a public health crisis officially and one isn't? We do want to do that. We want to do a role play. So one has been politics and one is policy. And so what I try and do is, talk to you about messaging, because we're all on the same page, but we need to communicate that without being on the red people on one side, the blue people on the other side. I went to a conference on guns recently, and we want to be purple. We want to be a purple America. We're all in the middle. We all care about kids. So how do we change that? And so one is politics and one is policy. So I don't do politics. I promote health policy by providing information. This is data. These are the solutions. It's about health policy. So there's no one thing that's going to solve this. 50% of kids who die in the country are homicide. Very few result from mass shootings. It's 1 to 2% of deaths are mass shootings. It's a really small number, but it gets the most media coverage. So, you know what? So be it. It gets media coverage, but we need to highlight the vast majority of kids that are dying from homicide and suicide. So if it's homicide, it's African Americans are 10 times more likely than white kids to die that way. If it's white kids, it's suicide. So those are the kids that we need to really think about. What are the solutions? So if arming the security guards is not going to take care of the vast majority of kids who die in this country, if that's what we really want to do. So the AAP says no guns at all. But if you do have a gun, keep it locked, unloaded with the ammunition in a separate place. Does anybody have a gun in this room? Yeah. No, at home. A gun owner. Okay, so he is a responsible gun owner, right? Well, sort of. You keep it locked, unloaded. You know, it's not, you don't want a kid to get to it. And I went to a gun show. I'm not a gun owner, but I wanted to learn. And they all agree on background checks and safe storage. So, you know, what the media portrays is not necessarily what I think most people believe. So, you're right. But if you do, then be responsible about it. When they did look at people with kids who had mental health issues, they found that people who have kids with mental health issues and people without mental health issues, kids, they stored their guns exactly the same. So it's not working to say, hey, it's up to you as a parent to do this. They're not doing it. So if we want to blame mental health, we also have to get parents to store their guns as well so they don't have access to them. So what we don't know is a lot. We don't know a lot about the problem and the solutions. We also don't know about the ripple effects of gun violence. And this is like what, you know, the Parkland kids, everybody's worried about them. Most likely going to have PTSD. You know, they've been through something horrific. But we don't talk about all the kids with homicide and suicide who have grandparents and siblings. There are thousands and thousands of kids across the country who are affected by gun violence. And all we're doing is counting the injuries and deaths. We're not counting the thousands. So I have been, you know, publishing or trying to publish on calling gun violence an adverse childhood experience. Does everybody know the adverse childhood experience? Okay, great. So gun violence is not one of those ACEs. I think it should be. And if we call it that, then we can get prevention resources and intervention resources early so they don't become victims of gun violence or perpetrators of gun violence, which is their trajectory, right, if they've been exposed early. So there are different kinds of advocacy opportunities, and we'll talk about messaging, I think, afterwards. I did a study on the Ask campaign. Does anybody know the Ask campaign? It stands for Asking Saves Kids, and it educates parents on asking if there's a gun where their child plays. I didn't say in your home. I didn't ask if they had a gun if you had a gun in your home. I just said, hey, just make sure wherever your kid goes, if there is a gun, that your kid is safe. That's all. And we found that these parents wanted that education. 96% of them wanted the education, and they said only 11% of providers were providing it. So it's actually a topic that parents want. They want to learn how to keep their kids safe. It's not politics, it's policy, and it's about saving lives. I'm also doing another level of advocacy beyond clinical advocacy with your patients on providing education on safe storage is community advocacy. So I have a grant with another doctor to find out what kids want. You know, we're hearing from the Parkland kids, which is amazing. We want to hear what inner city kids have to say. You know, what do they want? You know, like, you know, they have the same problems, if not worse, every day. Like, and their problem is they don't feel safe outside of school. Inside school, they're fine, actually. Their favorite place is in school. So we have what's called a photo voice project, where kids will tell the problems and solutions to gun violence in the South Bronx through photographs. And we're working with this place called the Bronx Documentary Center. And so we're really excited about that. They actually just got highlighted on CBS News, this particular center. And this particular center is, you know, all about the community and helping the community. We've also talked to kids about what they want from their provider. And what they said is they don't want a checkbox, you know, of a visit. And if there's a checkbox that says are you suicidal or not, it doesn't work for them. They're going to check no because it's just easier. And they don't really feel connected to their doctor because their doctor is doing checkboxes and computers, not making eye contact with them. They're like, even if I had problems, I don't really feel comfortable telling you, and you don't really seem to care. I'm telling you what the kids are saying to us. And it's been amazing bringing them with me to doctor audiences. Because I say to them, you know, they come up on stage and they say, what do you want from your doctor? Nobody's ever asked them this question. You know, it's very interesting. And now I think we need to empower them to tell us what they want, because what we're doing is not working. So we're working on that, getting the youth to tell us more. I did a focus group with inner city teens, and an 11-year-old like raised his hand, and he said, I think there should be more, and he's a little 11-year-old black kid. And he said, I think there should be more police outside of my school. so I can get home from school. And I think there should be cameras outside my school. So the kids are actually saying they want help and they want the grown-ups to do that for them. But I think we need to give them opportunities to do that. There's one policy that on a state level for advocacy that I think is very important. It's called Extreme Risk Protection Order, and Jeff is going to talk about that. But that's the policy that is going through. Has anybody heard about this? Okay, and it's called a red flag. Okay, so that's what it is. And Jeff will talk about that. The good thing about ERPO in New York is that school officials can petition to remove guns from kids and from parents. I think that's it. So I'll let Jeff talk, and then if we have time, we'll do messaging. Do you want to do it that way?
Sure.
Okay.
Okay.
Does anybody have any questions before we go into what the science says about gun violence? No. Okay, great.
We have found that people are really upset because there is this idea that there's a lot we don't know about gun violence, and there are a lot of policies that have been presented that one side or the other will say, well, there's no evidence for an assault weapons ban, for example. We don't know that saves lives, and so there is this red herring argument that we don't have enough data to support, a policy here or a policy there. But there are policies for which there are very good evidence. We know they save lives, and we know they save children's lives. And we are going to tell you about those 3 policies because it is a way to get involved. And the first step to getting involved, I think, is just education and awareness around the facts on this issue, because there's so much nonsense being said about the issue of gun violence in the United States. So I just want to start by saying that if you watch CNN or Fox or any of these sort of cable news stations, it can be very misleading. We hear about a mass shooting, it feels like every week at this point. And it seems like if you watch this sort of the news cycle, these mass shootings account for the majority of gun deaths in this country. And most people who have educated themselves on the issue and are reading the paper know that while these mass shootings command 99% of the media coverage around gun violence, they contribute to fewer than 1% of all gun deaths in the country. There's a researcher named Garen Wintemute who started a gun violence research center in California, and what he says, which sort of stuck with me, is that if you take the last 4 mass shootings in this country, and what's crazy and sad about this is that these are not even the last 4 anymore, because there have been more. This is not including the Pittsburgh shooting at the Temple and the Thousand Oaks shooting at the yoga studio, but the 4 major mass shootings before that were the Sutherland Springs church shooting, the Parkland shooting, the Santa Fe High School shooting, and the Las Vegas concert shooting. And in total, 113 people died in all of those events. But what's important to realize, and I say this without understating or minimizing the tragedy associated with those deaths, is that it is important to realize that we have nearly that number of gun deaths every single day in the United States. So Nina just said the number, but the CDC just released new data saying that it was 40,733 people, I think, died in 2017 from gun violence, meaning 109 people die every day from gun violence. And so it is important to remember that. Those deaths do not make the news because we have become so desensitized to them, but that's the gun violence death that we want to talk about today. So why do we care so much about declaring this a public health epidemic? Nina had talked about how, for some reason, guns are unique. We have declared Ebola a health crisis. We've declared the opioid epidemic a healthcare crisis. If you look at one of the original healthcare crises in the United States, you see that we're going to talk about car deaths. So in the 50s and 60s, I don't know if my cursor works, it doesn't, but in the 50s and 60s, there was an epidemic of traffic fatalities in this country. Car deaths were going through the roof. And I pick cars because the car, like the gun, is a very quintessentially American possession, right? It expresses values of freedom and power and individuality. And like the gun today, the car once was responsible for a lot of death. We faced a crisis. You can see this line going up in the 50s. Car deaths were going through the roof. So what did we do? There was an outcry. There was an outcry over the number of deaths occurring from traffic fatalities, and the federal government recognized that. And they acted because there were so many people dying from it. So what did we do? Most importantly, we didn't ban cars. That's not how we made them safer. And the same can be said for guns, which we'll talk about. We have no intention, nor do we want to ban guns. We absolutely support responsible gun ownership, like your husband. But Congress, when car deaths were going through the roof, found the political will to allocate millions, hundreds of millions of dollars, which eventually added up to billions of dollars. And they essentially told a body of researchers to go figure out what the problems are, figure out what the solutions are, and Congress was ready, they stood ready to enact policy based on this body's research findings. And what was the effect of all of that, of this public health infrastructure that was used? The curve went flat. You can see that. The car deaths dropped dramatically, nearly 60%, even though today we drive so much more than we did in the 60s. So what about our response to the epidemic of gun violence, right? Similar epidemic, cars and guns today kill almost identical number of Americans, around 39,000 Americans each year. So why is that curve looking so different for guns? It looks like we've made no progress. And the fact is we have made no progress attacking the epidemic of gun violence. And why is that? Because in place of this public health infrastructure that we had used for Ebola, for the opioid epidemic, for cars, we are doing precisely the opposite for guns. And I just want to explain to you quickly why that is. So here is all of the leading causes of death in America, the 30 leading causes of death. And this is a paper that came from JAMA, which is a big medical journal. And what they did was they compared mortality rates for the 30 leading causes of death on the x-axis with their corresponding research funding on the y-axis. So how much money do we spend to research how to cause less death from this leading mortality rate? And what they found was that gun violence falls way on the bottom, was the second least funded cause of death after only falls. So doctors or researchers are literally doing research, more research on how to prevent falls than how to prevent a child or an American from dying from gun violence. And just know that that does look dramatic, how gun violence falls, but this is a logarithmic scale on the y-axis. So each increase is by a factor of 10. So it's much more dramatic than this graph sort of gives it credit for. So how did we get to this point where we simply do not do research into one of the leading causes of death in this country? So it's a very specific point in time, and it's an interesting story in American history, and it's important to know about because I think this is the first step to reversing this. So these are two papers in the New England Journal of Medicine, probably like the Bible of medicine in terms of journals. And in 1992, the New England Journal of Medicine published two large CDC-funded studies. The studies tried to answer the question, does owning a gun in your home make you safer? And what they found was that despite gun owners' hopes, owning a gun in your home gave you a 3-fold greater risk of homicide and a 5-fold greater risk of suicide. The NRA was very offended by these studies because they reflected very badly on gun ownership. So they had a self-described point person in Congress at the time, and his name was J. Dickey. Has anyone heard of J. Dickey or the Dickey Amendment? This is why I'm happy we're here. This is critical, and you are not now, and you're going to tell 10 friends about this. Because when we give talks not infrequently, and very few people have heard of this, and it's really outrageous. And so it's important that people know about what the Dickey Amendment is. So what is the Dickey Amendment? So J. Dickey from Arkansas, at the NRA's behest, inserted an amendment into the House spending bill, how we fund how we spend money, how the government spends money. And it stated in blue that none of the funds made available for injury prevention at the CDC may be used to advocate or promote gun control. That is the Dickey Amendment. It has persisted in every spending bill since 1997. it doesn't literally ban gun violence. It doesn't say to researchers and physicians, you cannot do research into gun violence. But its real goal, and one that it achieved, was essentially an NRA-sanctioned warning to scare federal agencies into thinking twice about even collecting data that reflected badly on gun ownership. And they succeeded. The CDC funding was removed from the next budget. CDC funding fell by 96% into gun violence research. And over the next 20 years, while 600,000 Americans would die from a gun, the CDC essentially did not study the problem. So here's that same curve. And now I'm just circling motor vehicles in orange. So I told you that cars and guns both kill the same number of Americans every year, but there is a huge funding disparity. Remember that logarithmic scale between them, right? Funding is on the y-axis. So why is that? There was no Dickey Amendment for cars. It would have never been tolerated by the American public. People were dying. We faced a crisis, and there was no moratorium on research because there was such an outcry about how many people were dying. The exact opposite we've done with guns. We've simply not researched the problem. We don't know what the causes are, and we don't know what the solutions are.
Smoking, everybody remembers, like, the tobacco industry did this. They knew it was killing people, and they didn't allow the data and the research to come out. And then finally it did, and everything's changed because of that. You have, like, airplanes don't have smoking anymore, you have to air out your clothes in the restaurants. I mean, it's really changed dramatically. So I think that industry is the gun industry. The adage was, the adage that people say is, guns don't kill people, people kill people. So this disproved that. This study found that guns actually do kill people. It's not the person, it's the gun.
And I'm just going to repeat again that we made cars safer. Those death rates dropped by 60%, not because we ever banned cars. We all benefit from the billions of dollars used to research the problem, from shatterproof windshields to the very specific 4-foot median barrier in the middle of the road to the way cars were engineered. We all benefited from those billions of dollars, and car deaths dropped dramatically. So that is the Dickey Amendment, and that is one of three things that Nina and I, the American Academy of Pediatrics, cares a lot about for 2019, and trying to overturn what we're calling not a ban on research, but essentially a de facto ban, because there has been a political chill. The NRA has made it so clear that if you do this research, we will send letters to to the head of the NIH, the head of the CDC. We will make your lives miserable, and the fallout from that has been a true political chill on gun violence research. For time, I'm going to talk to you. I just want to talk to you about pediatric suicide because you probably are all. I wonder if you're feeling sort of the effects of an increase that we're seeing in pediatric suicide, and what we are trying to do about it. So the New York Times covered this, I want to say in March, and it found that essentially the number of kids presenting to emergency rooms for suicidal ideation or a suicide attempt has tripled in the last 10 years, which is really staggering. And we're seeing that translate into completed pediatric firearm suicides in our emergency room. So from 2007 to 2015, that increase jumped by 70%, kids killing themselves with guns. So suicide is the result of lethal means in the moment of crisis. When psychiatrists talk to children about who have attempted suicide, what they find out is that the child didn't decide on a Monday to kill him or herself and then act on Friday. It is a moment of crisis. They deliberate for fewer than 10 minutes because of some awful stressor or an event, and they kill themselves, not knowing the repercussions of that. So with guns, 90% of people, of children who kill themselves, who attempt suicide with a gun, die. The exact reverse is true for this figure with every other method. So I, as an emergency room doctor for kids, at least once a shift I see a child come in with a suicide attempt, most commonly from swallowing pills. And they almost never, ever die. 98% of kids who swallow pills to kill themselves survive. The exact reverse is true. 90% of kids who kill themselves with a gun die. So if we can figure a way, so if children can get their hands on a gun in that moment of crisis, they are much more likely to die. And where do kids get these guns? The kids who kill themselves, where does the gun come from? So there was a very, very good and sort of large study done by David Hemingway, who's at Duke. And he looked at 145 kids who killed themselves with a gun in 6 states, pretty varied across the country. And his question was, his research question was, where did the child get the gun? And what he found was that 4 in 5 kids got the gun from their own home. 80% of kids got the gun from their own home. So how do we prevent children from getting their hands on a gun in this moment of crisis?
What is considered children and adolescents?
Very good question. So there's a debate on this, but most people will say up to 18. The problem with guns is that you seldom get a second chance, as opposed to swallowing a pill or some other method. And then one sort of argument you hear from the other side is, well, it doesn't matter. If a child can't get a gun, he'll find some other lethal way to kill him or herself. And the fact is, the data, it just does not bear out the data. It's not true. 70% of people who attempt suicide never do so again. So, policy 1, which we want your help in supporting, because it's important to come from healthcare professionals in the mental health field and school officials and school administrators, because we have a policy that we know will prevent pediatric suicide. It is called a safe storage law or child access prevention law. Has anyone heard of this? So 18 states in orange have a safe storage law. And basically what it says is that if you live in a home with a gun and a child, the gun needs to be either on you in person or it needs to be safely secured. We know that 1 in 3 kids in the United States lives in a home with a gun. And we know that most of those guns, people say over half when they do survey studies, are not secured. So CAP laws or child access prevention laws seek to drop that number dramatically. We believe that we live in this like bastion of progressivism in New York State. New York State passed the SAFE Act in 2013. If you guys heard of that, it was Cuomo's big gun violence bill. And what it was missing was a safe storage law, which is one of the only laws, in fact, probably the only law we have to protect our youngest kids. So why is that? I think I'm going the wrong way, sorry. So that bill in New York City is called Nicholas's Law. It was named for a child with a tragic story of a friend who shot him accidentally with his father's unsecured gun. One of our big goals for 2019 is to pass a safe storage law. And now that the New York State Senate has flipped, we're a nonpartisan organization, but we can say that the New York State Senate has flipped to gun violence champions, and there is some belief that we'll be able to pass a safe storage law this year. So in terms of the data, because again, the whole point of this talk is to tell you guys things that you can help us support that are not just a feeling, but that have evidence that they save lives. And safe storage, I'm just gonna go through this very quickly and just tell you that the RAND Corporation, which is a nonpartisan research institute, about a year ago went through every available gun policy we have on the books right now in this country. And their question was, what is the evidence supporting any of these laws? So they looked at assault weapons bans, they looked at stand your ground laws, they looked at mental illness and firearms, they looked at minimum age requirements, they looked at concealed carry permits, and after every policy that they looked at, you see this graph, which just says the evidence for this relationship is completely inconclusive. We don't have enough data to tell us whether assault weapons bans work or they don't work. The only policy where they gave their highest evidence rating, which is this green figure, was for safe storage. And what they found, meaning that they had overwhelming evidence that laws designed to keep guns out of the hands of children reduce firearm suicides, and they prevent accidental shootings as well, which we're not talking about today, but it makes sense that if you do not have a gun lying around in your home unsecured, you're less likely to have a toddler shoot a toddler. This is one of the biggest studies for safe storage, but for time. The second policy and the last policy that I'm going to tell you about that Gina mentioned is ERPO. And this really applies to you guys at work. We believe that this will maybe be the first bill passed in terms of a gun violence bill in the legislature of 2019, but we need help to do it. So what is ERPO? So ERPO was created because we often find that people who commit homicide or suicide, before they do so, display alarming behaviors before they commit the act. And so the Parkland shooter is a very good example of this. He posted threatening messages on social media. The police were called to his home twice because he was in a domestic violence dispute with his mother. But in the state of Florida, at that time, they now have ERPO, and New York doesn't, if you're sensitive theme. But the point was that Florida at the time, because he could not be arrested, he didn't meet the threshold to be arrested or committed, nothing could be done about those guns in his home. And so the point with ERPO is it allows loved ones and law enforcement, if they see a person who is, quote, at extreme risk, you can petition to have those guns removed from the home temporarily. And the point in New York, and how it applies to all of you, is that the New York bill includes school officials and school administrators. And so you are empowered to attempt to suspend guns from a home in a home where you think a child is at risk. And the reason that we support this bill is because, one, we know that mental illness is so stigmatized in this country in terms of gun violence, even though we have very good data to show that a person with mental illness is far more likely to be the victim of a violent act than the perpetrator. But this law does not stigmatize mental illness. It doesn't say, if you have schizophrenia, you can't own a gun. It is based on behavior, not a diagnosis. So it is anyone. It is, hypothetically, if my grandmother passed away and my grandfather's very depressed and I see it, and he owns 7 guns in the home, I could petition before a judge to have those guns temporarily removed. There's due process. We don't just rip these guns out of the home. That person defends him or herself in front of a judge, and only if the highest evidence threshold is met are those guns temporarily removed for up to a year. So again, every state around New York has passed the ERPO. All of those states in blue have passed, in orange, I'm sorry, have passed the ERPO. Florida has passed the ERPO. Everyone in Florida owns a gun. We call it the gunshine state, and they have passed the ERPO. New York still has not passed it, and it's outrageous. I'm going to save you the largest study ever done on ERPO, but basically the take home for this study, and we can talk about it after if you're interested. The take home was that Connecticut was the first ERPO law to ever be passed, and since it passed in 1999, there were 762 ERPO cases activated. And what they found was that, when they crunched the data, was that for every 10.6 ERPO cases activated, the number needed to remove was 10.6, meaning for every 10.6 cases activated, they prevented 1 firearm suicide. Now, that number, obviously, that number means different things to different people and in terms of where you stand on the issue. But in terms of risk versus reward, it's interesting to know the data. The last thing I'm going to say is the Dickey Amendment, which we talked about. So the 3 things I want you to walk out of here with today are knowing safe storage, ERPO, and the Dickey Amendment. J. Dickey passed away, I think, in 2004. I don't remember exactly, but was it?
Yeah, because he said, I regret that it's just before.
You're ruining my slide. The point is here is before he passed away, he wrote this big mea culpa in the Washington Post, regretting what he did. And basically what he said is that scientists don't view traffic accidents as accidental or senseless. They look at them as events capable of being understood and prevented. And he believed that the same could be done with guns. So even Dickey, for whom the amendment is named, came to regret the Dickey Amendment. So we're going to stop there.